I'm guilty of falling asleep to the TV, sometimes waking up in the middle of the night, realizing that it's still on.
It happens to all of us, but new research suggests that falling asleep with the television on can lead to weight gain. Dr. Zorba Paster joins us from his office in Oregon. Hi, Zorba.
Hi, good to see you guys.
We're taking your calls at 270-9933. It's a good day to call in if you have a question for Zorba. We have 3 lines open, and while we're waiting for the calls to clear, Zorba, tell us a little bit about this. How does leaving the TV on make you heavier?
Well, it's a very interesting study. First of all, the study was a big study, 40,000 women. It's called the sister study. So they're women who had a sister. In other words, they looked at one sister and there had to be 2 sisters on the study. And then they controlled for things like diabetes, high blood pressure, what medications they were on, and so on. And lo and behold, the sisters who kept the television on, keeping the TV on just before they went to sleep, gained more weight, roughly 10 pounds more weight than the ones who did not. And so they looked back in the data and said, what do they think is going on? And it may be melatonin release from the pineal gland. In other words, the pineal gland's in our brain, and it may be it's related to the blue light that comes out of a TV screen and out of a computer screen. And it may simply affect how we sleep and then what our appetite is like during the day. So it might be that you have a stronger appetite during the day when you've got the TV on when you go to sleep. In any case, it may be something that's worthwhile thinking about. Hey, turning off the TV is certainly easier than dieting for many people, and that might make a difference.
Oh, that is really interesting. All right, a lot of people are waiting to talk to you, so let's get to the phones, okay? And we will start with John in Janesville. Hi, John. What's your question?
Hi, doctor. Say I experience pain in one of my ankles at night, and sometimes I'll take an Aleve prior to going to bed, or maybe a Vicodin, but it's to a pain where it wakes me up. What do you think about getting a cortisone shot?
Well, sometimes cortisone shots can really make a difference. They can be very, very useful. If I were to choose between Aleve and Vicodin, I would stay away from the Vicodin. It's an opioid, and your body kind of gets used to it, and it's not nearly as good as Aleve. And sometimes if one Aleve doesn't do it, you take 2 Aleve. That's the usual prescription dose that we doctors give. Aleve is naproxen in the common dose, but that physicians give us 500 milligrams twice a day, and 2 Aleve is nearly up to that dose. But I would stick to the Aleve, and I would talk to your doctor about a cortisone dose.
All right, very good.
All right, let's talk to Pat now in Wisconsin Dells. Pat, what's your question?
Yeah, Doc, how you doing?
Good.
I was just wondering, how does a doctor diagnose arthritis besides the patient saying that their joints all ache?
Well, that's a pretty good recommendation. Joints ache, older person, your joints are not like they used to be. You're pretty much arthritis. You can do really a clinical examination. Changes in the fingers and the hands where the fingers become a little bit knobbly. They're not nearly as smooth. Changes in the knee where the knee becomes a little bit distorted. So clinically, you can pretty much make the diagnosis of arthritis, which is generally osteoarthritis. The issue is with something such as rheumatoid arthritis, that requires a clinician to look at things, a blood test, and a few other things that they look at. But the arthritis of old age, osteoarthritis, clinical examination, that's really all you need. X-rays are fine, but it's the clinical examination that really gives you the answer.
All right. Let's go to Stephanie in Fitchburg. Hi, Stephanie. What's your question?
My question is, what does the doctor think of the lotions that you put on your legs for muscle cramps? And if a person has high blood pressure, should you not use those lotions if he deems them helpful for cramps?
Oh, sure. Those lotions, by the way, can be quite useful. Some of them are lotions, they're lotions such as Bengay and others. They basically they're called a counter irritant, and they actually change kind of the way the pain and the cramps and how they actually bind together. And so if it works for you, I would definitely use them, especially if they're over the counter. Now, they do not, on the whole, interfere with blood pressure at all. But if you're worried about it, you go and get a blood pressure cuff. Either you buy one, they cost about $30 now. Check your blood pressure before and after you put on lotion. But generally, those lotions do not affect blood pressure, so I would not be concerned.
All right, very good.
All right, let's head over right now to Michael in Edgerton. I believe we're going to try him. Michael, are you there?
Yes.
What's your question, Michael?
Okay, yes, I've had loose bowel movements for the last 2 weeks. Should I be concerned?
on the whole, I'm not usually too concerned about a loose bowel movement. Now, the average person is either 1 bowel movement every 3 days to 3 bowel movements a day. If there's a change in your bowel movements and it stays that way, that really means a call to your doctor because there might be something going on. But after a few days, if you have a loose bowel movement, I wouldn't do anything specifically about it. Old-fashioned Pepto-Bismol, which, by the way, will turn that stool black, but old-fashioned Pepto-Bismol often works well. But on the whole, I tell people just clear fluids, eat something that's really easy on the stomach, stay away from Mexican or hot food, and generally it'll clear up on its own.
All right, that's all the time we have for today, unfortunately. Thanks for your calls, everybody. Thanks, Zorba. Good to see you.
Good to see you guys.
All right, we'll see you next time.
All right.